So thank you so much for this opportunity to speak to this wonderful group. I really appreciate it. So we in this country pride ourselves on many things, and rightfully so, and not just hockey and bacon and maple syrup. So what's one of the things that we take the greatest pride in? Well, it's our healthcare system. Why is that? Well, we, in this country, we like to pride ourselves on our healthcare system. We take, we love to compare ourselves to our neighbors to the south, and we like to talk about our free healthcare system, Now, we know it's not free. It's a little game that we play with ourselves. In fact, we spend tremendous amounts of money for our so-called free healthcare system, something like more than 40% of the provincial budget, like $62 billion, goes to our free healthcare system. But we like to think of it as our free healthcare system because when you show up at the doctor's office or a hospital or the ER or a specialist, you don't have to bring a big bag of cash with you. You don't have to bring your Visa card. So you don't have to show up with this bag of cash. As long as you've got that green Ontario health card, then you get your foot in the door, right? It doesn't matter whether you're rich or poor. It doesn't matter whether you're pretty or ugly, stupid or smart. We're all the same. Once you have that card, we all get the same access to the healthcare system. So, we like to think of it then as this equal access, And so then we think, well, if we have this equal access, then we must have an equal healthcare system, right? Again, you have the card, you're in, right? And I think then by extension that we then trick ourselves into thinking, well then if we have an equal healthcare system with equal access, then we all must have equal health, right? Now we know that we don't all have equal health, but we put that down to people's behavior. So, this person eats too much, this person drinks too much, this person doesn't get enough exercise, right? And that's how we think that we have these differences in our health, right? Well, I'm going to show you that there's nothing equal about healthcare in Canada, and that there's absolutely nothing equal about the health of people that live in our city of Hamilton. So in April of 2010, we started a discussion in Hamilton. It was called this discussion Code Red. It just was the name of a project, but it's sort of become over time kind of a brand. And what we did was we used health and socioeconomic data from 2006 and 2007, and we were able to map the health of people in Hamilton down to the level of small little neighborhoods. Okay? They're actually called census tracts. That's the way that Statistics Canada breaks down cities across the country. And the beauty of us using these census tracts is because that's the way that StatsCan collects social and economic data, we could then do apples-to-apples comparisons when we looked at people's health data as well. And so in Hamilton, there's about 140 of these census tracts. In the lower inner city of Hamilton, a census tract can be as small as 5 or 10 square blocks. And out in the rural parts of Flamborough, a census tract is as big as a town. And so what we were able to show were these very strong connections between people's health, people's wealth, and where they lived in the city. So a little bit about me. So my background's not actually in journalism. My background's actually in science. I have a degree in human biology. Because of that, I'm Mr. Science Guy at the Spectator. So anytime somebody can't figure out a percentage, which happens a lot more frequently than you might think, they land at my desk. So I'm the science guy, and so I do a lot of science-related things. And I've always liked, even when I do my larger investigative projects, I like putting on my sort of science mindset hat and attack the problem the way that you would attack a science problem. So, you figure out what your hypothesis is, you figure out how you're going to collect the data, you go and get your data, you analyze your data, you try to make sense of your data, and you come up with your conclusions, much like you would with a science experiment. So many years ago, my bosses came to me and they said, we have some money. And that's how I know it was a long time ago, because nobody ever says we have money right now. And they said, we have some money, and we want to do some testing. And they meant like some actual scientific sampling. And I said, okay, well, what do you want to test? And they said, well, you're the science guy genius, you tell us. So what if we looked at where people lived, and then looked at their health, and then tried to figure out what we should test, right? And I admit that I was thinking of this from an environmental standpoint. And so I put together this long, heartfelt proposal, and I shopped it around all over the place, StatsCan, all these different places. And everywhere I went, I heard the same thing: great idea, can't help you. And it was always because of the privacy of people's health data, which I understand. And I'm not a researcher, I'm a journalist, which puts me in the wrong camp. So, I ended up at McMaster because they were doing some pretty innovative stuff with air quality and air quality monitoring and that, and went to the head of the geography department, and he said the same thing: great idea, can't help you. And he said, as I was walking out of his office, he said, but have you spoken to a gentleman by the name of Neil Johnston? And I said, no. And he says, well, Neil does exactly what you're trying to do. He maps health data. So Neil didn't know me, but God bless him, he agreed to work with me. And so what did we do? Well, we put together a proposal to CIHI, the Canadian Institute for Health Information. CIHI is basically the warehouse for all hospital and emergency room data for every hospital and ER across the country. They're mandated to send their data there. And so what we did was we got access to 2 years worth of health data for every person that listed Hamilton as their address. And so what did we get? Well, we got every hospital and ER visit. We knew the date that they were in the hospital or the ER. We knew how long they stayed there. We knew what time they showed up. We knew the age of the person. We knew the gender of the person. We knew everything that happened to them from a medical standpoint, because it all has these complex codings that get attached to it. We even knew whether they did or didn't have a family doctor. But the most important thing that we got was something that allowed us, we didn't know the person's name, which was fine, we didn't care about that, but it allowed us to turn that person's visit into a dot on the map of where they lived. And that was the most important thing. Massive database, about 350,000 pieces of data. And that allowed us to take all of these hospital and ER visits and all of the things that were happening to people, so group them into these little pieces of geography, these census tracts. We'll call them neighborhoods. It's easier to just think of them as neighborhoods. And again, because that's the way StatsCan collects social and economic data, we could then look at all of these health outcomes and all of the social outcomes and all of the economic outcomes and look for the patterns. So, this was the first Code Red, which we published in April of 2010, and created a bit of a stir. And as sort of the highlights, I think the thing that probably shocked people the most was we found that there was a 21-year difference in life expectancy from the best to the worst neighborhoods. I say life expectancy, it's actually lifespan, but most people understand the term life expectancy. So we had one neighborhood in Hamilton where the average lifespan was 86 and a half years, which is great. As I said in the original Code Red, if that neighborhood had been its own country, it would have been #1 in the world, which is great. Unfortunately, we also had another neighborhood in Hamilton where the average lifespan was 65 and a half years. So if that neighborhood had been its own country, it would have been 165th in the world, worse than India, Mongolia, Turkmenistan. So we're really talking about third world outcomes in a country as rich and vibrant as Canada. So some of the other things that we found time and time again, we found these huge differences between the best and the worst neighborhoods in outcomes. So example, emergency room visit rates. So how often are people showing up in the emergency room? A pretty standard measure of people's health. And so worst neighborhood in Hamilton, 1,291 visits, ER visits per 1,000 people. So basically in that neighborhood, people were showing up in the ER more than once per person. So worst neighborhood, 1,291. Best neighborhood, 97. 1,291, 97. 13 times difference from top to bottom. And remember, this isn't a 13 times difference between the best and the worst neighborhoods in Canada. It's not a 13 times difference between the best and worst neighborhoods in Ontario. This is a 13 times difference in outcomes in one city. If it was double, it would be bad. If it was triple, it would be bad. If it was 5 times, it would be bad. It's 13 times difference. When we looked at people showing up in the ER for psychiatric reasons, it was a 33 times difference from top to bottom. Just staggering differences in people's outcomes in Hamilton. And what we found were that these huge gradients in people's health outcomes lined up very, very neatly with poor social and poor economic outcomes. And so these are our famous code red maps. So what you're looking at here, the big map at the bottom is the amalgamated city of Hamilton, thanks to Mike Harris. And so you've got the former city of Hamilton. The squiggly line that's on the other side of on the lower side of the link there is our famous mountain that makes people in BC laugh themselves silly. And to the bottom right, we have Stony Creek, and we have Glanbrook, and Dundas, Ancaster, Flamborough, and the inset is the former city of Hamilton. And so the map you're looking at is sort of what we called our super map. So we took 12 different health outcomes and ranked all of the neighborhoods from top to bottom. And then we took 12 social and economic variables, ranked them all from top to bottom, took all of those, threw them in a blender, jumbled them all up, and came up with the overall rankings for all of the neighborhoods. And what do you see? Well, we're very smart at the Spectator. Green is good, red is bad. And so what you see are all of the worst outcomes are located in the lower inner city of the former city of Hamilton, and all of the best outcomes are in the rich suburbs around the outside of the city. As I say to people, Hamilton is a lot like a donut. It's got this healthy ring around the outside, and unfortunately it's got this rotten hole right in the middle. So, about a year and a half after the original Code Red, we did our second health-related Code Red project. I guess I hadn't ticked Neil off enough. He agreed to work with me again, and we called this one Born. This one looked just at the health of moms and babies, so maternal health and birth outcomes. But this time we looked at the entire province of Ontario. 4 years worth of data, massive data set, 535,000 pieces of data. And one of the things that we looked at was teen moms, and big, huge problem in Hamilton. And as you can see, as you move away, the red is the lower former city of Hamilton, and as you move away from the lower former city of Hamilton, the rates get better and better and better as you get out into the suburbs around Hamilton. And so if you look at the black dot there in the center of the dark red, that's a sliver of Hamilton that's between Sherman and Wentworth Streets, from the water's edge to the escarpment. If you can picture that area of Hamilton in your mind, it's probably one of the most devastated parts of the inner city. And so in that little sliver of Hamilton, over the 4 years of data that we had, there were 667 births during that time. And of the 667 births, 100 of them were to teen moms. So basically, in that part of Hamilton, slightly more than 1 in 7 babies was being born to a teen mother. And if you look at that black square up in northeast Burlington there, so that sliver of Hamilton, Sherman to Wentworth, 667 births, 100 of them teen moms. In that part of Burlington, there were 774 births, 0 teen moms. Not a single teen mom in that part of Burlington. And if you look at the boxes in the two corners, the one in the bottom right shows you some of the statistics for that part of Hamilton. The median household income is less than $36,000. That's actually below the poverty line for a family of 4. You see that nearly half the kids, I'm having a hard time seeing here, nearly half the kids live in poverty. More than a quarter of the families are single mom families. And you contrast that with that part of Burlington there where the median household income is about $106,000. Just a tiny fraction of kids live in poverty or single parent families. Nearly half the adults had a university degree or diploma. So what is it distance-wise between those two black squares as the crow flies? I don't know. Maybe 15 kilometers? Those two places might as well be on different planets. There is nothing about that place in Hamilton that is like that place in Burlington. And as Leah Carragata said, she's a professor at Wilfrid Laurier University. She studies the issue of teen moms. As she said for this series, she said, you know, That place in Burlington there, it matters to your life trajectory whether you do or don't get pregnant as a teen. In that part of Hamilton there, it may not have any impact at all on your life trajectory whether you do or don't get pregnant as a teenager, which is kind of sad to think about. And then in the fall of 2013, we did our third health-related Code Red project. This one was on cancer. This is probably the one that scared people the most, and I think that's just because cancer in general scares people. You know, I think it's because what scares people about cancer is the randomness of it. You know, we all know good people living good lives who get hit with cancer. I know there's lots of behavior-related cancers, you know, that are, you know, linked to things like smoking. But there's also a lot of people live good lives who get struck with cancer, and it's like, oh, why that person? They're a good person. And so what we found was that, yes, in fact, there is a lot of randomness to who gets cancer, but there's a lot less randomness in who dies from cancer. And so Cole's Notes version here, we found that the cancer mortality rate in that inner city core that kept showing up in red there in those maps was 90% higher than Ancaster, the richest suburb of Hamilton. When you looked at it on a neighborhood level, the mortality rate was 4 times difference between the best and the worst neighborhoods. And when we looked at lung cancer, it was off the charts. It was 15 times difference in mortality between the best and the worst neighborhoods. And this map just shows you lung cancer mortality and how it's, you know, with the exception of, I think, 2 census tracts, which are still in the city of Hamilton, all the rest of them are in the lower inner city of Hamilton. So, 10 years on from our original data, we decided to return with a new question. What's changed over the last decade? And sadly, not much has changed. In fact, most of the health outcomes have actually worsened over a decade. If our original Code Red series was seen as sort of a call to action, I think we've kind of reached the point where we're at a primal scream for action now. So, I'm going to talk to you a little bit about ER use, psychiatric-related issues, hospital admissions, lifespan, ALC days, alternate level of care, low birth weights, family physician accessibility, and a little bit about the socio-economic factors. So, ER use. So the first thing that we noticed was that over a decade, ER visits have gone up by about 30%. Okay? Now, Hamilton's population has increased, but Hamilton's population has only increased by about 6%. So there is a huge increase in ER visits that has nothing to do with just the fact that there's more people living there. And so if you look at it, the pink line is from a decade ago, the red line is, and so if you just broke the city into 3 parts, the lower former city of Hamilton, the mountain, and the 5 suburbs of Stony Creek, Glanbrook, Ancaster, Dundas, Flamborough, then you see that there has been big increases in ER rates. And what's worrisome is that it's increasing all across the city, and proportionally the increase is actually higher on the mountain than elsewhere. So, a word of explanation about what you're going to see here, because you're going to see this graphic. So, one of the things that we decided to do this year was, in the other projects, we sort of looked at census tracts a lot, and we decided not to focus so much on census tracts this time, because what we realized is that when you have 140 census tracts are going to move up or down a little bit over a decade. So we realized that, you know, if the census tract was 120th 10 years ago and it's 115th now, it moved up 5. It doesn't really mean it. Big deal. You know, you're still crappy. So what we decided to do was group the census tracts into 10 areas of the city so that you get a better, it would even out some of the trends and you get a better sense of what's going on. So I want you to pay attention to the shape of this graphic. Okay, so first of all, the 10 areas are, if we go from the top down, so LE stands for Lower East. That's the lower east part of the former city of Hamilton. So that's Kenilworth Avenue to the Stony Creek, to the edge of the Stony Creek border. The lower central part is from Kenilworth to James Street, from the escarpment to the waterfront, probably the most devastated part of the city of Hamilton. Lower west is from James Street to the Dundas border. EM stands for the East Mountain. That's from Upper Wentworth to the Stony Creek border. The West Mountain is from Upper Wentworth to Ancaster, and then you've got the 5 suburbs of Stony Creek, Glanbrook, Ancaster, Dundas, and Flamborough. And so I'm always going to present them in the same order. So I want you to pay attention mostly to the shape of this graphic, okay? And so again, the pink line is 10 years ago, the red line is now, and you can see that with the exception of Flamborough, where there's some wonky things going on, either the people in Flamborough are the healthiest people on the face of the planet, or they have a pathological aversion to hospitals, or both, I don't know. There's some weird things with Flamborough, but what you can see is everywhere in those 10 areas, the emergency room visit rates went up across the city. And you can see just how different it is for those parts of the lower city of Hamilton, or former city of Hamilton. And so these maps are basically from 10 years ago on the left to now. And what you can see, so these maps don't show rates. Basically, it just shows the census tracts broken into groups of 20%. So you don't have to be worried about the rates. You just have to see the darkest green are the best 20%, and the darkest reds are the worst 20%, and the other colors are in between. And what you see here is that over a decade, really nothing's really changed in terms of the distribution of the best and the worst outcomes. In fact, if anything, there's just been a further consolidation of the best outcomes in the richest suburbs of Hamilton. So what's one of the reasons for the increase in the ER rates going up so dramatically over a decade? Well, the easiest explanation is that we just have an aging population in Hamilton. Hamilton has, as you can see, over the last 20 years, Hamilton's median age has gone up by 6 years, which is pretty significant. Of the 10 largest cities in Canada, Hamilton has the oldest median population, and actually by far, compared to the next closest one. Right now, more than 1 in 6 people in Hamilton, about 93,000 people, more than 1 in 6 people in Hamilton is now actually 65 years and older. So, first of all, I'm not blaming old people for that high ERs. It's just a fact that the older that you are, the more that you use healthcare services. And when you have one of the oldest populations in Canada, then naturally it's reasonable to assume that your hospital and ER use is going to go up. Psychiatric-related issues. So I don't know if crisis is the right word, but it sure looks like we have a crisis in Hamilton when it comes to psychiatric-related and mental health-related issues. So again, pink is 10 years ago, red is now. And this is looking, if you looked at all ER visits and figured out the causes of ER visits, these are showing the proportion of those visits that are for psychiatric-related emergencies. And you can see that, again, the worrisome thing is that everywhere across the city, there's been big increases in the proportion of ER visits that are for psychiatric problems. And you can see now that there's still this socio-economic gradient, so that the lower city is worse than the mountain, which is worse than the suburbs. But again, it's the scale of that increase that's worrisome. And if you break the city into the 10 parts, you can see just how different there is, the differences between the lower inner city, the top 3, and the 5 suburbs. But again, it's up everywhere across the city. And so if you just looked at a rate based, per thousand, you can see that the lower form, so from the mountain is cut in half from the lower former city of Hamilton, and then it's cut in half again to the 5 suburbs. And if you looked at the rates, you can see just how different the city is when you break it into these 10 areas. You can see that the lower central part of the city, from James Street to Kenilworth, the rate of psychiatric emergencies is 10 times greater than it is in Flamborough. And again, if you looked at on the left from 10 years ago to now, you see that, again, there's really been no difference in where the poorest outcomes are located. And again, if anything, there's just been a further consolidation of the best outcomes around the outside of the city in the richest suburbs. Hospital admissions. So, red is the just hospital admissions in general, and pink are urgent hospital admissions, so that's when you show up in the ER and they say, you've got to go to a hospital bed immediately. And you can see again that there's this huge socio-economic gradient between the lower former city and the mountain and then to the suburbs. And if you look at hospital and urgent, so hospital admissions in red from now, and pink is a decade ago. If you looked at hospital admissions as a proportion of ER visits, you can see that there's been big increases in both hospital admissions and urgent hospital admissions as a proportion of ER visits, which suggests to me that people that are showing up in the ER now are showing up in much worse condition than they used to a decade ago. And if you break it into the 10 parts, so this is the proportion of hospital admissions that are urgent hospital admissions. Pink is from a decade ago, red is now. And you can see that everywhere across the city, the proportion of urgent hospital admissions has grown over the last decade to the point where 2/3 of all hospital admissions in the lower city are now urgent hospital admissions. Lifespan. So, this is for men in Hamilton versus men in Ontario. And so on the left side, from a decade ago, the red line is for Hamilton, blue is Ontario. You can see that actually a decade ago, men for the entire amalgamated city of Hamilton were actually slightly better than the provincial average, which is great. Unfortunately, over the last decade, men in Hamilton have improved a little bit, but they've actually fallen behind the rest of the province. And when we look at women, it's the exact same story. Women were actually slightly better than the provincial average a decade ago and have now fallen behind the rest of the province. This is probably the most horrifying graphic that I will show you today. So if you take the average lifespan for the 10 parts of the city and break it down from the pink from a decade ago till now, if you look at the second one down, the lower central part of the city, this is from James Street to Kenilworth, you will see that over the last decade, the average lifespan has actually declined by a year and a half. Declined. That's the type of thing that they're seeing in rural parts of the United States that are devastated by the opioid epidemic. We're seeing that in the lower central part of the city. And I'd just like to point out that that's not a statistical anomaly based on just a couple of deaths. There were actually 1,241 deaths that made up that average. That's not an insignificant part of the city. There's 68,000 people that live in that part of Hamilton. That's like a good-sized town. So it's not just an anomaly. And you can see that everywhere else in the city, lifespan has increased. And if we just break the city into the 3 areas, you can see that there's been an increase on the mountain and in the suburbs, but there's actually been a slight decline for the entire lower part of the former city of Hamilton. That's like 180,000 people. But more importantly, there's a 5-year difference in lifespan if you live in the lower former city of Hamilton than if you lived on the mountain, almost 6 years if you live in the suburbs. So what's one of the possible reasons? Well, as I mentioned, we're seeing some of the same impacts of the opioid epidemic in Hamilton that they're seeing in all parts of across North America. And you can see the huge spike in opioid deaths in 2017. And I haven't seen 2018's numbers, but I have no reason to believe it's going to be less than 2017. If anything, it's going to be higher. So, and those are people that are dying probably in their 20s, 30s, 40s. And so that's going to have a huge impact on average lifespan. ALC Day. So ALC stands for alternate level of care. So basically alternate level of care days are measured on by hospital admissions. And what it really means is people who are in a hospital bed who really need to be somewhere else, like a long-term care facility. And the problem is that there's no place to put them. And so they end up in a hospital bed when they really shouldn't be there. And what that does is it causes sort of a chain, a backlog throughout the entire chain. And so what we're seeing is that the average number of ALC days has grown substantially over the last decade, again, in all parts of the city. So why is this important? Well, In 2017, there were more than 69, so if you added up all of the days for all of the hospitals that had an ALC patient in a patient occupying that bed, it comes to 69,000 bed days for that year. If you translate that into a per day basis, it's the equivalent of having 189 hospital beds in Hamilton out of service every day because there's a patient in there who needs to be somewhere else and there isn't a place to put them. To put that into context, 189 hospital beds, that's larger than Guelph General Hospital. So that's the equivalent of having a good-sized Ontario hospital taken out of commission every single day in Hamilton because there are patients in beds who need to be somewhere else and we can't find a place to put them. And so if you broke the ALC days down by the 10 areas, again, you can see that there's been big increases in places like Flamborough where it's doubled, Ancaster where it's almost doubled, the East Mountain where it's almost doubled. Low birth weight babies. So it's taken quite a while, but we finally found some good news. This was one of the only areas that showed some improvements, and that's great because low birth weight babies was a huge problem 10 years ago. And you can see that there, so pink is a decade ago, red is now. You can see that there have been substantial reductions in the rate of low birth weight babies all across the city. Most notably in the lower part of the former city of Hamilton, which is fantastic. Low birth weight babies are a huge cost to the medical system, and there's lots of studies that show that low birth weight babies are a huge drain on the healthcare system for the entire life of the low birth weight baby, not just while they're in, say, the neonatal intensive care unit. And if you break it down into the 10 areas, you can see, again, that there have been really nice increases for almost every part of or decreases for every part of the city, quite noticeably in the lower central part of the city. You can see just how bad it was before. And in fact, the lower central part of the city isn't now even the worst of the 10. Family physician accessibility. So finally, the second piece of good news. So everywhere across the city, we noticed big reductions in the rates of people who have a family. So big reductions in people saying that they don't have a family doctor, and really substantial reductions. But again, if you look at the 3 areas, you can still see, even though there have been big reductions all across the city, there's still a huge socio-economic gradient to what you're seeing. It's still more than twice as high in the lower former city than it is in the 5 suburbs. And again, if you look at it on the 10, you see these huge reductions, which is great. But again, if you just focus on the dark red, you still see that familiar shape. You still see that there is this big socioeconomic gradient between the inner city and the suburbs. And again, 10 years ago till now, you still see that there really hasn't been much of a change, though, in how the distribution of the outcomes. And again, if anything, just another consolidation of the best outcomes in the richest parts of the city. And so what's the paradox? Well, as I told you at the outset, so we have fewer people showing up in the ER saying they don't have a family doctor, but it hasn't done anything to keep people out of the ER. As I told you right off the outset, ER visit rates are up 30% over the last decade. And what's really interesting is that if you were to just look at the proportion of unique visitors, so who, out of the population of 530-some thousand people in Hamilton, what proportion of people actually show up in the ER in any given year? It's actually quite small, at least it was to me. There's only about a quarter of the population that actually goes to the ER in any given year, which means 3/4 of the population will never set foot in the ER. So when you're talking about those 255,000 ER visits in a year, it's really condensed down into just a quarter of the population, because the other 3/4 aren't even going to be in the ER. Socioeconomic factors. So I asked you at the outset to sort of pay attention to the shape of the graphic, and the reason why is because this is poverty rates, and you can see that over the last decade, there really hasn't been much of a change. I mean, there's a couple of percentage points here and there, but frankly, there's really not been any movement in reducing poverty rates. But more importantly, look at the shape of that graphic. It mirrors and mimics so many of those other graphics that I've shown you. And so what this tells me is that poverty plays such a crucial role in all of the other things that we're seeing. And if you look at average household income, it's kind of the inverse, not surprisingly. You can see just how different the parts of our city are when it comes to household income. And again, really no change over a decade. If anything, again, another consolidation of the best outcomes in the richest parts of the city. And if you looked at the proportion of people's income that comes just from government transfers, you can see just how concentrated. So the red is the people who have the highest proportion of their income coming from government transfers. That could be pensions, but it's probably also disability, Ontario Works. And this is probably the second most horrifying graphic that I'll show you. So these are the rates of people that have post-secondary education. And you see that a decade, so the red ones are all pretty much still in the same, the dark red ones are all pretty much in the same places. The pink ones are the next worst batch. So the 20 to 40% worst rates of people with post-secondary education. You see that a decade ago, most of those were actually located around the periphery of the city of Hamilton. In a decade, there's been a flip. So now that second batch of the worst results have now flipped all into the old city of Hamilton. So now the 40% of the worst post-secondary education outcomes are now all concentrated in the former city of Hamilton. So we acknowledge that 10 years is probably not long enough to change something as fundamental as population health, because that means you also have to change social, economic factors, and it requires not just the municipal government, it requires the federal and the provincial governments. But while 10 years might not be long enough to see big changes, it's more than enough time to be concerned about the lack of progress that we're seeing in the city. Thank you.